Welcome to the Capes of Kamloops podcast, where we look at our local heroes in our community and celebrate the work they do through the movies on the big screen. I'm one of your hosts, Zach Milne. With me is Kyle Robertson. And today we are joined by Kim to talk about the Robin Williams 1998 classic, Patch Adams. Welcome, Kim, to the podcast.
Thank you so much for having me.
Thank you so much for being here. We had to reschedule once, so thank you for your patience with that.
No problem. It's so strange to get such official messages from kids that used to run wild in my house looking for freezies and stuff like that. It's great.
Yeah.
It's great. It's exciting. I'm really excited.
It's really cool to, I should stop bumping that. It's really cool to get to interview you, and it was nice to get back in touch with Tegan. I feel like me and him get back in touch like once every few months, and
that's great.
So yeah,
that's great. Yep, those friendships are gold.
Oh right? Yeah, definitely.
Yeah.
Nice. So just to start us off, what's kind of your experience with Patch Adams?
Well, I'm old enough that I actually saw it when it first came out. I can't remember if I saw it in the theater, but I might have, because I'm a huge Robin Williams fan. Nice. And it came out in 1998, I believe. And so I'm also thinking, I was really hard between babies at that time. And that's probably why it resonated, just because I would have possibly been home during that period of time in between my second and my third child. So, and away from nursing for a while, and also looking at nursing at a time when I'm going to have children home. Where am I going to work? Where can I be so that I'm available to them? And what I loved about it was Robin Williams always brings a spin. You always expect Robin Williams to be the same person in every movie, and he isn't. He's a huge talent, and I loved that he was doing something with my field. So yeah, so my experience with it would have been a movie that I saw automatically because he was in it, and even more interesting because there was a healthcare piece. Because I had only been a nurse at that time for 3 years. So I became a nurse in 1995. It's 30 years this year, actually.
Wow.
Oh, wow. Congrats.
Shocking.
Congratulations.
So that happened yesterday. Yeah, that's yesterday. Yeah, just was yesterday when I graduated.
Wow.
Yesterday in about 15 minutes or something.
Oh, wow. Crazy.
Perfect timing.
Yeah, it goes in a blink. So my experience with it is that I saw it originally. I actually just rewatched it just for the podcast, and it stands the test of time.
Nice.
It's actually even kind of more current now, in a way, because he was so ahead of his time, and now the way that we do things is very similar to the way he wanted things done, which is talking to patients.
Mm-hmm.
Yeah.
Nice.
That's right. Yeah, in the movie, Robin Williams plays a pre-med student who is more interested in the person behind the disease than the disease itself, and that causes some friction and some conflict between him and his superiors. And I'm just curious, watching the film, obviously it's based on a true story, and it's a 90s feel-good type movie, so Robin Williams' character is always in the right. That's how he's depicted. But I'm wondering, from a practical real life in the field scenario, where Robin Williams' character was so convinced that it was so important to know the person and to make the person feel personable and to feel like they were important before just seeing them as another patient. Do you find that is a practical way and a good way to go about it in the field? And do you have experiences yourself of going about that way with the patient, much like Robin Williams' character believed that doctors and nurses should?
Yeah, I think that at the time that the movie came out, there was a very active trope that possibly wasn't yet catching up to reality, that doctors were separated from their patients and nurses were the conduit between the patient's emotions and the feelings and their fears to the doctors, but the nurses were subservient to physicians. That certainly was the case. You used to have to stand up when a doctor came into the room, and that was only 5 or 6 years before I started, which was in 1989. You used to have to give up your seat. the way that Robin Williams plays it, of course, Robin Williams is in that role to make an overstatement of something, because he's so. I'm sure it was really hard to act with him, because I think 3/4 of what happens in a Robin Williams film ends up on the cutting room floor. There's just no room for it in a standard, and he probably just gave the editor tons of material. And so what I love and what resonates about Robin Williams and his portrayal at that time is you see that now. So there isn't a division between physicians and their patients unless physicians want to create that division. So I started my career at Children's Hospital, and when you worked at Children's Hospital, you couldn't ignore the entire family when you were providing care, and parents were afraid. And so the physicians that stayed there and the physicians that were beloved were people who could make connections, who were wearing Disney ties and had toys on their stethoscopes and had things for the kids to do while they were doing their examination. They had soft hands. They almost always made sure that they made kids laugh. They knew what was currently going on, and they took the time to listen to what people were saying that they needed. And so I would say that Robin Williams' portrayal of certainly a resident or a medical student certainly is now what we try and do. And so if you're asking me for something that I've done with patients, I've most recently worked in labor and delivery. It's a very intimate time in a couple's life, and you have to be very aware that this is a place where you have been invited to be. It's an honor to be present at the beginning of life, at the end of life, when somebody's experiencing their worst moment. And the patient shouldn't be grateful to you. That's not their job. That's not your job, is to make them grateful to you. Your job is to try and advocate for them, to be a voice for them. And that's exactly what Robin Williams does. You know, there's a little old lady who won't eat. She won't eat. I can't get her to eat. And Philip Seymour Hoffman, oh God, this film is full of such great performances. But Philip Seymour Hoffman this is serious. This is serious. This is serious. But sometimes the needs of patients are not serious, and you can't find the answer because you're looking through a particular lens. And that's why he comes to Patch to say, how do I get her to eat? And Patch goes, I know how to get her to eat, because she told me once she wants to be in a big thing of spaghetti. She wants to squish spaghetti. Like, let's just do that. And he just got that through a conversation. You know, what do you love? What do you like? And so I would say that care and nursing now is very patient focused or family centered. And so our job is to come to these people and say, what would your ideal be in this situation? And to be a voice. And for us, maybe to be a conduit between physicians that sadly don't get to spend as much time with their patients. Because I'm sure that if physicians had enough time to spend with their patients, nurses and physicians would their care at the bedside would look very, very similar. So I don't know if I answered your question, but
Oh, I think 100%. Yeah.
But yeah, I think that the way that Patch approaches patients, if there was time built in, and I think that that's a really important thing for healthcare workers right now who are struggling with just abysmal staffing, is to just remember that when you're feeling overwhelmed, you can go to the bedside and you can just sit down on a chair and say, how's it going? Like, is there something, what's the most important thing we need to get done for you today? Like, what can I speak for you is there something, what's your hope for today? Is that something that I can do? And that person will feel listened to. And it takes 10 minutes. And you always feel better when you're in the room providing care. That's what fixes us. It's hard. It's scary. I'm not saying that there's not times when healthcare right now is feeling a little bit broken. Sometimes free healthcare looks free. And that's hard to be part of that, when you feel like you're patching things with duct tape and things like that. But the truth is that every nurse that I know goes to work and physician, goes to work to do a really good job. And the way that I heal myself is I go into the room and I'm just in the room. And if the patient feels, if you can somehow get a patient through the day where they're not aware of how busy we are and how pulled in every direction, and that's what Patch does. Patch is he's busy. He's a third-year med student. Now, okay, the whole him getting A's and never seeing him read a book, it's
We're
tough.
going to get to that.
Okay.
We're definitely going to get to that.
Okay, good. Yeah. So that's what I would say about that. I lose track of sometimes you're going to have to bring me back, but it's there's a reason that you stay a nurse for 30 years, so you feel passion. And I felt joy watching this movie. I liked the portrayals. I thought that they were possibly extremes of what you would see in different places. I think the tropes were, heavily built upon, but it allowed people that aren't in healthcare to see the different roles very clearly. From this is okay, so a medical student can't come into hospitals until third year. That does happen, nursing school is a little bit better, I think. We're in long-term care usually in first year, and that's where you start. You learn how to do personal care, and then you go up in ability until you're in specialized areas. Medical students, their first 4 years of becoming a medical student, they're buried in books. They're buried away from being at the bedside, and it can give you a distance. And the workload of a physician. I mean, nurses are busy too, but the workload of a physician is crushing. It's designed to test your mettle, and sometimes there just isn't time. Some students have it. They have a great bedside manner. They're very interested. And some medical students they're stressed, and it shows, and I don't blame them. There's a reason that, people become nurses and people become doctors, and it's just like anything. Personality brings you in. How long you want to go to school, all those things. But I thought that Patch reminded me of patients that I've had that are difficult, and that moment when you make a connection with somebody who's hard, or if everybody tells you, oh, this person's really having a tough time, they're a little bit hard, and you can make a connection. It feels certainly like a victory, not a victory over anybody else, but just, a victory. The solution is always, the solution to what's wrong and what's happening in healthcare isn't at the nursing station desk. It's in the patient room. Mm-hmm. So you go in there, you spend time, you recently had a baby, you go in there. I maybe didn't look at, if you don't look after that person, but that person, you go and you say, hi, I'm here, I'm in the community. If you need help, let me know. And like during a really big moment, you just go, okay, all right, what's your number? I work nights, 3:00, I'm up, that's what you do. And then people feel empowered. They're like, okay, she's saying that it's okay for me to call at 3 a.m. So when I'm awake at 3 a.m. down the road, well, the nurse said I was going to be awake at 3 a.m. So this is normal. This is okay. So the connection you make and the way that you fix healthcare is in the room, if you can. It's the way you fix you.
Nice. I love that the idea that, it's not just good for the patient,
Yeah.
That's amazing.
Yeah.
Yeah.
Well, look at how healthy and how good he felt. And remember when I can't remember her name. What was her name?
Oh, was it Carrie?
I think
or Karen, or
I think it was Karen.
Something with a K.
Yeah.
And she was just so stressed, and he said, this is going to make you feel great. And it did, you know? I mean, she was just completely bogged down in everything that she has to do. And I think a lot of medical students are. My daughter is currently a nursing student. She's in her 4th year, and she's going into the same area that I am. And I just keep telling her, we can't solve the problems at nursing in the nursing station, and you only want to talk about it so much there. Just go into the room. Go into the room. Providing care and doing this work isn't as hard as it seems when you're standing around trying to solve the problems of the world at the nursing station. When you go into the room, the needs sometimes are very simple. You know, somebody's crying and you can see that they need reassurance that this is going to get better. Well, we're all human. We can provide that. And I think people that are pulled into nursing have maybe a skill with that, where they have a way of approaching people that they just think, okay, this is going to be all right for now. Maybe not forever, because we're all realistic, but you know, it fixes you. It fixes you. You know, if you rush to get out of a patient room and you land in the nursing station, like even the nurses in the film, you know, they would be in a room and then they would come together and they would kind of, and we all do that. We're just like, oh my gosh, this patient is just, oh, it's so much. And yet, did any of them find solutions standing at the nursing station, like complaining about what was going on? No, it was the person that went into the room that talked to the patient that found solutions. And it feels good because you don't have to make huge sweeping changes. You just have to listen. And so the answer is actually just right there. You have to ask them, what's going to make you feel better? What makes you feel happy? The things that Patch asked. What makes you feel good? The man that wants one more safari, you know? And it wasn't that it had to be a real safari, but it was that somebody listened to him and tried to create something like that. So when you go into a room and somebody says, I wish my mother was here, which I hear a lot. It's really hard for a lot of women and families who are giving birth to wait for family who are away, who live in India, to get visas to come and be here in time for birth. They have 10 months and they can't get their family member. Some can't get their partner here, you know, in time for a birth. They're going to school and they're having a baby and they don't speak the language and they can't get their traditions to be there. And you can just say, is there anything we can do? You know, is there something we can do? Do you need a letter? Do you have a connection in the community? Have you heard about, you know, this immigrant service that's available to you, you know? Or do we have a interpreter? We have an interpretive service available now. I had the best experience once. I had an Iranian family, and they spoke Farsi exclusively. The father spoke a little bit more than the mother, and the mother spoke full Farsi, and he understood enough to manage the situation. But when things got into medicalese, it's much more difficult. So we had this interpreter services. So I thought, well, I'm going to call the Farsi interpreter. It's available 24/7. It's an amazing resource. And she's having a baby and it's a male interpreter. So there's a modesty factor, right? With many cultures around birth. The only pediatrician we had available was male. And I was so proud to work with that group of people that night and with that family and with that interpreter that night, because it wasn't all eye rolling, oh my goodness, we're not going to be able to do this. It was like, where can we look at this baby so that we can preserve modesty in this room? How can we use the interpretive service? We stopped using the camera, of course. And then he was just a voice in the room, and we even turned the iPad, you know, away so that there was no way that anything, and at the end of it, everything could be communicated. The baby was born healthy. The mother did fantastic. And the interpreter was just jumping up and down saying, this is amazing. I've never heard birth before. This is just a wonderful thing. And it was just a simple thing. You know, this gentleman who was charged with looking after his wife and interpreting everything that was happening in the room became overwhelmed. And you had to think, come on, there must be a way to do this. How can we do this? Oh my goodness, we have an iPad rolling out in the hallway doing nothing there that could be brought in. And so, you know, those are things now, and finding and breaking down those barriers. When you have a moment where you can do something like that and it turns out so well, you know, you always look back and say, oh, it was so simple. But, you know, in the moment, everybody's all caught up. Like the physicians, you know, they're all caught up with, this is how this is supposed to go.
Right.
Can we do this? Is it, you know, and you're in medicine. Is this legal? Is this private? Is this, you know, you have all of these other things that have to go on. And I just have so much respect for people that are looking for solutions instead of enumerating the barriers. What does that do? It doesn't make you feel good. It makes you feel overwhelmed, right? There must be a solution, So anyways, that was I don't know how many questions you're going to get through. Keep going.
No worries. This is perfect. One thing I do want to point out is we're in the nursing building at TRU, who they very graciously have allowed us to interview you here. So I wanted to ask, what is the integration like as people come into nursing at Royal Inland? How you were saying you'll start seeing them in extended care, it was?
Yes. So nurses in first year spend time with more elderly folks in assisted living and in long-term care. And second year, you're starting to get busy doing med surg. So we're looking for clinical placements where people are doing dressings and dealing with medical complaints like high blood pressure, and those nurses get involved in doing flu shots and things like that. In third year, you're starting to see some specialty areas come out. People are maybe doing some experiences in emergency. There are a lot of times by the end of third year, nurses are considered trained to work as care aides. Actually, at the end of the second year, you can work as a care aide in long-term care facilities. At the end of third year, you can work as a care aide anywhere. For instance, my daughter worked as a care aide in ICU and on 7 North, and which is a cardiac ward. And then in your fourth year, a lot of it is very specialized clinical. By the fourth year, you have an idea. You've had a smattering of community, you've had some mental health, you've had med surg. On our unit, because Kamloops has just the one hospital, although sometimes there are clinicals in Salmon Arm and other places, there are a lot of students to get through. And after COVID, with the numbers of nurses so low, there really was a period of time where we were all really tired of, you want to teach, but you also want to make sure that they have a good experience. And nurses that are a little bit beaten down, it's hard to teach somebody new. And you're also worried that you're not quite sure if there's trauma there that you're passing on. So there was a period of time, I think it was really hard to be a nursing student and feel like they get a good experience. I think that nursing students, they come in just eternally interested. I've never had a nursing student, if I say, oh, do you want to come see this? Yes. And I love that. And what we need to do is we need to protect that, when they come in. I think that the integration of nurses, I think that Kamloops is a specific place that's new to me. I grew up in Burnaby. I trained at UBC in the 80s before computers. Pausing for reaction. And nobody there was going to live at the coast. Nobody could afford to. So we were all going to scatter to the four winds. We never knew where we were going to be. By the end of our fourth year, we were to pick a clinical area, and I picked pediatrics. And then I quickly it was the last nursing shortage in Canada, was in 1997, nursing surplus. In Canada was in 1997, and so you couldn't get a job in nursing to save your soul. Wow. We lost a lot of nurses to the U.S. I couldn't even get a job in long-term care, and finally the ward where I had done my extended practicum, I got hired on at Children's Hospital, which was wonderful, and you begin your learning as an adult. A lot of nursing students come out and they're just 4 years out of high school. And my daughter happened to be out for a period of time. She's older going out, which I think is an advantage to have a little bit of life experience. It must come down like a ton of bricks. It did for me. I came out of high school and I couldn't have been greener than the greenest grass that ever grew. And I found myself 5 years later nursing in a nursing station in Anaheim Lake, BC, which is about 3 hours. You hang a Larry at Williams Lake, and then you end up at the top of the Belcoola Hill. And I was nursing there. I learned great things there. Yay, Carey Price. He's from there. But yeah, the integration of nurses into the hospital, it's gradual. They start in the community and long-term care, and they move into more acute more acute fields and areas as they figure out what their skill set is. I mean, thank God there's nurses that will work emerge. That's not me. I can't do it. You know, I'm up there with my hands above my head going, oh, what am I going to do? And those nurses are just, they're chill, and they've just got the next answer in their pocket, which is great. But, you know, I'm just glad that there's so many different personalities that come into this field, physicians too. And no one physician is the same. We assume all female physicians are the same. They're not. We assume all male physicians are the same. They're not, you know, and hopefully through this, traverse from first year to fourth year, you figure out what you're good at and where you fit, you know, for somebody that works where I work with women and children, you don't get a lot of time to work in that area until you're in third year. So for my daughter, I don't think it's saying too much to say she was worried that she wasn't going to find her place. And then she came to women's health and she found it. And I think that that's how it is for a lot of nurses. And if they don't find it at the end of school, you go looking for some of the more creative ways, like being a flight nurse or working in a rural community. You know, we need more Indigenous nurses. We really need more Indigenous nurses, because I think I'm very lucky, and I work with a nurse. I work with the nurse Katie on our floor, and she is one of the questions that we ask in our area is would you like to keep the placenta? And when I ask non-Indigenous families that, they think, well, we probably asked you that.
Yeah, we said hard no to that.
Yeah, it was. But then when they're kind of looking at me strange, I think, well, the opportunity is there to say that in Indigenous cultures, they take the placenta home and they bury it somewhere where the baby will always declare as home. That may be their actual home. It could be their band, like their grandmother's land. It's a beautiful tradition. And when we explain it that way, this is where we live. I mean, this is an opportunity to teach, you know, some of the beautiful cultures around birth. Our immigrant families. I have families that come in from the African continent, and they will put their newborns they'll carry them on their back. Something that if you put that into our white bread culture, sorry, I'm just in myself in that one. They would just say, oh my gosh, that's not safe. And yet these babies cry less by report by parents. They're carried safely. I watched a mother do it. And that baby was 2 weeks or 2 days old. He'd cried for half of the day. The auntie came in with 2 long scarves that she got from Ardene's or something. And she had that baby calm in seconds, awake on her back and calm in seconds. And what we're finding, especially in women's health, is that we're coming back to what works. And to bring Patch Adams back into it, what he's doing is he's doing grassroots community care. He's saying, what do you need? Okay, and remembering always, whenever you watch a film and it's based on the US, nobody has health care.
Yeah.
Okay.
Yes, that is
so nobody has health care because it's too expensive, and so the poor can't get health care. There's no when I'm working with my maternity clients, there is no paid maternity leave in the United States. It is the only first world country that has no paid maternity. And so whenever you're watching videos from that place or movies, you always have to remember there's a reason that people are in so much need. Mm-hmm. There's a reason that those mothers are pumping from day one, because they'd have unpaid leave, if they're lucky, for 6 weeks. And then they're going back to work. So if you want to learn how to pump breast milk, you need to watch an American video, because those ladies have got it figured out. Okay. We in Canadian society are lucky, although I think it's still stressful for families, because you can get parental leave and you can get maternity leave. It's not in most cases enough, but at least hopefully we hope that it's enough for a woman to learn how to feed a human.
Yeah. I mean, you were there when my son was born, or you were one of the nurses that helped my wife and I. And I can speak for experience from my wife that, like, maternity leave is like a huge thing for her, like a huge blessing. Like
Yes.
we've talked about that a little bit about how, can you imagine if you had to go back in 6 weeks, or like you weren't getting any income at all for being
Yes.
here? Like it would just cripple us entirely.
Yes.
And I believe our son would suffer more
Yes.
for it if my wife wasn't home, because she is such an amazing caretaker of him. And they really, like, especially at the early stages and being a new baby and all, like they're still attached. Like it's still like he still thinks that they're one body.
Human babies don't know why you want to put them down. What's the problem here? Like, hello, didn't you read the manual? It says I'm to be carried for 1 year. It's clearly in my contract.
It's so just amazing to see how important it is for her to be there for him, like 24/7,
Absolutely.
and just like how much she can do that I can't and no one else can do, because it's her baby.
That's right.
From her. And so that's just, from firsthand experience, is kind of cool to hear you say. But going back to Patch Adams,
yes.
kind of bringing it back to the movie.
Yes, please.
We were trying to remember the girlfriend's name, the love interest. Carrie?
I
Are we
think
just gonna
it's
go
Karen.
with Karen?
Yeah.
We'll go with Karen. We'll just
Yeah.
go with Karen.
Cool.
Because one of the big things in the film for her,
Corinne.
is that what it is?
It was
Yeah,
Corinne.
yeah.
Corinne.
I think it's Corinne.
Corinne.
Yeah.
All right, we'll
There
go
we
with
go.
Corinne, and they can correct us in the comments if they want to. But it's Corinne.
They will.
They
will.
definitely will. We can easily look at IMDb, but we are not going to pull out our
No.
phones because we are professional.
Exactly.
That's right.
Going to her character, we find out that there's a layer of why she kind of pushes Robin Williams away at the beginning, but
Yes.
another reason that she gives as the forefront reason is just how much harder she has to work as a woman
Yes.
to pass the classes and get ahead of the guys.
Yes.
And being a woman yourself and having gone through that experience, especially you said 89.
Yes.
So in the 90s was kind of when you were
Just starting.
and
Yeah.
going through that. How relatable is her struggle with that to you, and do you see that continuing in the field and with these new nurses that are coming in fresh out of med school?
Yes. I think that the one advantage of being in a female-led profession is that you didn't experience sexism within the university setting. I didn't have to fight against. It was actually the men. So
Okay.
you had to take a different perspective. I had really talented men who were in nursing with me. Some of them were there to get a degree so that they could get into medicine. And it looks good to have a nursing degree when you go into medicine. Certainly. And some women were actually using nursing as a springboard to something else. So we're not dumping on anybody here or minimizing, their motives. But the women, what we felt and what we got was the nursing, certainly nursing as a profession, enjoys a respect and a power that I got to experience from the get-go that a lot of women in male-led professions, which was every other profession except a select few. So what I was seeing in the 80s was certainly a lot of movies like Working Girl and different where a woman was fighting in a male-led profession. One of my favorite people on earth is Ruth Bader Ginsburg, and her fight to have to answer at a dinner to the head of Harvard Medical School why she thought that she deserved a place that could be taken by a man, and that was not the experience in nursing. In nursing, we welcomed men. We didn't get enough, and we still don't have enough. And I believe that a mix of the sexes, and maybe that isn't the right term, a mix of the genders, and even across genders, of all identities. I think that you just build a richer fabric. You have, when I talk to Katie about why are we asking this question, I learned something, and that makes me a more empathetic nurse. I think that most physicians I knew were male. When I came out of nursing school in 1993, you didn't run into many female physicians who were specialized. I did work with one. She was a plastics physician, and she worked with pediatric burns, and she was fantastic. As we started to see more and more women, what you saw with women is you saw women go into female fields. You saw female obstetricians. You saw female GPs. But you didn't, I have yet to see, I know a neurologist who's a female, but I don't know. Oh yes, actually there is a neurosurgeon in Kamloops who's female, which is amazing. Vascular surgery. We have a female orthopod here in Kamloops. But those were especially orthopedics. So any surgery that involved drills and power tools tended to be a very male dominated profession.
Right.
But you did start to see some, and we have amazing female doctors here in all fields. We have general surgeons, we have orthopedic surgeons, we now have neurosurgeons. I almost forgot her. But they're still kind of lone, except in obstetrics, where we're actually seeing more women. And one of the big things that we're struggling with right now is getting enough physicians to look after women who are pregnant. I apologize to the audience that I keep bringing this back to labor and delivery, but it's a reflection of the wider world. And so as females enter into dominantly male-led professions and are also leading families, are stopping work to have families, you're going to see issues in healthcare with not enough doctors, because there's an expectation. Can you imagine if I want you to think for a minute, if your wife was a physician, and how much would fall to you for the child that she just had? Right. Physicians don't get paid maternity leave. They have to pay for it themselves.
Wow.
There's step one, by the way, in fixing how do you get physicians to BC, is you come up with a system for them to be able to take paid leave, to look after their families, to stop them burning out. They have a baby at home and they're working 24-hour shifts. This is crazy. Does it make sense? It doesn't make sense. And so what we saw is this shift to see more females, more residents who were females, making connections with nurses. I feel that from the 80s, it was much more Patch Adams. So it was much more the doctor. There was a hierarchy where you didn't question people, and maybe people weren't speaking to each other as equals. There was certainly a speaking down effort, but I worked at Children's Hospital, and what I started to see, especially in places like that where people are finding innovative ways to deal with serious health concerns, and frankly, it's well-funded. I worked at Children's Hospital, it was well-funded. I mean, I'm going to date myself, but they all got Sega, like in every room, which was humongous at the time.
That's sweet.
Oh my gosh, it was wonderful. But I had a physician bring a resident to the nursing station while we were doing report to dress him down. Not respectful, don't recommend it. However, I'd had an issue with this doctor during the night as a young nurse, worried about compartment syndrome in a patient with muscular dystrophy. Just so you know, it's difficult to determine if somebody's having an issue when they can't feel as you do. When I'm relying on pain and this gentleman doesn't feel pain the same way, and yet this can lead to him losing a limb if I'm right. And just, it's very busy to be a resident. It's exhausting. I wouldn't want to do it. I have so much respect for any physician that lived through residency, but I had a valid concern, and because I was very young, I mean, I was 22, so I used to look a lot younger. So I was forever having patients saying, "How old are you?" And I'm sure that's what he thought on this exhausting night where he'd had a million calls to the emergency room, and he snapped and got really angry at me. And although I could take that to my staff and be empathized with and supported, none of them had the power to go to that physician and say anything. And certainly what they did is they encouraged me to call the the higher level physician who wasn't on call. And so my voice shook through the whole thing. And I explained that I had a concern. And he asked me why I didn't tell the resident. And I said that this is what I did. And then I hung up the phone, and then my entire body collapsed. And I thought, and that's what it used to be like to phone a physician when you had to go above somebody else. It's not like that anymore. And that is good. That is a great thing, that there is much more collegial. There isn't as much hierarchy. You can each be called on things that maybe you're coming at from a different way. You have empathy for somebody that's been awake for 24 hours. We used to do silly things in the 80s, like for the physician who wouldn't write orders in a legible way, we would make sure that we didn't realize that until 3:00 in the morning. And then we would call and said, is this Tylenol order every 4 hours? We can't really read your writing. We don't do that anymore. We don't have to. We don't have to play power games, silly power games anymore, because you can have reasonable conversations with somebody, and we're seen as a whole team, an entire team. There's no, high or low. But for this one case, one of the best lessons I ever learned was this very respected orthopedic surgeon making sure he showed up at 7:15 in the morning, or I think it was 6:45 in the morning, with this resident in tow, and told this resident to apologize to me because this patient did in fact have compartment syndrome and did have to go to the OR urgently. And I shouldn't have had to go through that. And so that change was starting to happen at very high levels. Not so much in Kamloops. So the farther you get from Vancouver and the centers of excellence there, I think that we have excellent staff here, and we are seeing innovative ways of caring for our patients, and people are interested in doing it in a change way. But one of the biggest things here in Kamloops is how little transiency there is between staff that go into the hospital. So you'll train here, you'll work your entire 50 years in nursing here or 40 years in nursing here, you'll retire from here, and you maybe have never left the community. So seeing how other people do it. And that's, to come back to Patch, his entire way of being is, there's a different way to do this. And it's not what you're comfortable with. It's outside of your comfort zone. But if something's not working in the comfort zone, then what is the danger in looking outside? And also that what was so great about Patch at the time when he was doing it in the 70s is just that it wasn't easy to access research. I can say, I think we should do this different. And I can go, Dr. Google, tell me how different I can do this. Right. And he says, well, let me tell you, Kim, there's a study in Sweden that says you don't have to put bassinets in rooms, and you can just put big queen size beds, and the family all live in queen size beds. And that's how you get women breastfeed. I'm like, awesome. I'm going to take that to somebody here, and we're going to go with it. And 12 years later, it'll get on an agenda somewhere. It's going to be awesome. So, but it wasn't like that in the 70s. Like, they couldn't catch serial killers that were killing in one neighborhood over because nobody talked to anybody. And certainly medicine was exactly the same. So to do this innovatively in healthcare, you have to have vetted research. You have to have double-blind placebo studies for it to be valid, and what Patch was doing certainly wasn't one. And so that would always scare people off. Is this a one-off? Is this just because of his personality? What if we took Patch out of the equation? Would we still get the same results, or is it based on that particular person? And that's something that somebody would think of when they watch this show with a medical background, is it can't be it has to be able to be recreated. And so is this just a phenomenon? And that was what him creating the Gesundheit Institute was all about. Is this is this a one-off, or is this actually a way that we should approach care? And I'm quite happy to say that a lot of the things, one of the things that I did after watching the film was I went to Wikipedia. I paid my $5 because, let's keep Wikipedia going. And I looked up the Gesundheit Institute. Is it still running? Yes, it is. And it's leading research into innovative ways of, delivering healthcare, especially in an American setting, to people who are underserved, or in a kind way, or in a way, and it's just, and I just think, I kind of put that in my little favorites box, and I thought, this is an innovative way to go, a place to go. They know that they need study, and so they've created that because they know you can't change healthcare without proper study. And anyways, that's what I loved about the movie, again, was just that I was glad that we weren't there anymore. So when I came out in the 80s, we were coming out of that for sure. We weren't wearing caps anymore. So my year was the very first year. So when I went into nursing school in 1989, the VGH program in Vancouver had just ended, and they were transitioning to a degree as an entry to practice for nurses. And one of the biggest signs is we stopped wearing caps. That wearing those caps, by the way, they got caught on everything. They got caught on IV and everything overhead, and they would, you had 9,000, things, tied in there to keep them on. And if they yanked on you, you felt like you lost the top of your head. They were ridiculous. They were a sign of subservience. They were seen as a, although they were a tradition, they weren't a tradition that moved nursing anywhere. They identified women as nurses. They were mostly women. And so a patient would know they were talking to a nurse and not a doctor. The biggest complaint that patients had is, I don't know who you are. When we stopped wearing them, who are you? We're wearing, dating myself, clothes from Cotton Ginny, as scrubs. In pediatrics, we have Dr. Seuss on our, and I mean, a doctor could walk in at any time with the exact same t-shirt that I had bought, down at, at San Francisco, which was a store at the time that we used to go get novelty stuff from. So
nice.
Yeah.
Oh. Yeah. It's nice to know that things have been progressing since then. One of the questions I was going to ask was kind of more focused on like the character of the dean. Do you still see that kind of person who's heavily rooted in tradition to the point of maybe squashing newer ideas kind of still around in healthcare here?
Thankfully, no.
Nice.
I think that trope has, I can only speak for where I am, but there's actually been a complete reversal where it's the people that are looking at innovative ways to provide care, that identify with patients, that make the patients feel heard and listened to. Those are the people that are pulled to lead medical schools and lead nursing schools. It's people with lots of life experience. It's beloved physicians. I think that you do need, certainly, sadly, as long as post-secondary continues as it does, and we don't find a solution to get our youth educated in a reasonable way without incurring huge amounts of debt, there's always a marketing side of leading these, and so they're pulled in. I want to do it this way, but there's only so much money to do it this way. We need to find funding, and so sometimes it's people being able to find the appropriate avenues to make sure that you're getting help from places that you want to associate with, right? And people who are savvy about media. So the more that social media takes on a role in healthcare, I mean, what did we just live through, in 2020? Wasn't that, what happened?
Wild.
What
Oh man,
there?
feels like this weird blip.
Right?
We don't have to acknowledge it anymore.
I know. I mean, I have no political leanings except what is kind and what is backed up by research and makes sense. I mean, and but what we found during that time was that you can't just say it like, duh, and expect that to be your policy.
Right.
People had to know that you had considered things seriously and you weren't being patronizing about it. And I don't know anybody more patronizing than the dean in that thing. It's pretty bad. So he was awful. Awesome actor, though.
Oh, yeah.
But and he does it so well. I've seen him do that role in more than one place, and he does it very well.
Yeah.
But I, of course, who I loved was the other physician and even the head of the university, who recognized, that they're in the face of something that they may not understand, but that deserves to be supported. That they may not live to see a day when this is where it rolls, but that this is who you want to leave this profession to, and not people who are so rigid and so afraid. Anybody that lives their life with this is the only way it can be done must be afraid, because you must be afraid tomorrow. One of the things, I used to do lots of things in nursing, but one of the things that I used to do was infection control. And I was always aware that whatever you defend to the death today in healthcare, you need to be willing to discard tomorrow, because it runs with progress, and we learn more and we do more and we learn better and we do better things. And so you can't hold on to one thing forever. This isn't a place where you're going to be safe if you just think this. Your deepest understanding of things is going to be questioned by the innovators that come into the field, like Patch, like lots of other people. And so that's why those characters were in that movie. So you knew that there was hope, that there are older people that can run institutions that see, what you were obviously seeing, to have Patch have to go through the process where he is questioned about whether he. That's right. I mean, that's appropriate when somebody is possibly out of control. Is this okay? And how do we determine that this is okay? How does this help or hinder people? I think anybody that's an innovator in the field, and of course Patch is somebody that when you talk about change, there are people here that are going to be the last to come on board, and then there's going to be the ones that are out front that are the innovators. And clearly he's an innovator. But innovators, the first ones through the wall, they just get bloody, right? And the second one, they're just covered in a little bit of dust, and then it gets clean. And then it's like, okay, this is okay, we can do that. But we need all of these people that think along this way for us to decide this is the way we want to go. The ones that think, well, what about this? And what about this? And what about this? I'm so grateful for those people that I work with, because I'm like, yeah, let's change it tomorrow. Wait a second, Kim. How are the people behind you going to remember that we've changed this and why we did that? So I think that, as much as we don't like that dean, we need people like that to go, wait a second, is there a tradition here that what do we need to keep from the tradition, and what's keeping us from doing a good job that's based on that tradition? So
nice. Perfect.
What time are we at?
We are at 54 minutes on the camera, so it's 4:15.
Oh, shoot.
okay, sorry.
No, you're good.
No. That was all great. Very insightful, and I think I definitely learned a lot. I think people will learn a lot. Just kind of wrapping up.
Please.
No,
just make sure you get what you need.
Yeah, no.
No.
We have a couple things that we do before we wrap up the podcast. So first thing that we have is a segment called Feasible or Flimsy, which is a segment where we look at some sequences or things that happen in the film, and we just ask you who lives it whether this is feasible, it could happen, or if it's flimsy, completely just made up for a movie, which actually did answer a lot of questions that I did have within everything that you were saying. So we're not going to go as long in the segment. I don't think we need to, but one thing that you were starting to talk about that I was going to ask you about is there is kind of this accusation against Patch that he's not exactly doing the work, but he's doing really well with the test. And the movie kind of frames it as, well, because he's on the floor, because he's actually down there with the patients, that's kind of where his education's coming from. That's where he's able to pass. So what do you think about that? Is that feasible or flimsy? If Patch isn't hunkering down in the books, he's simply just with the patients on the floor, maybe getting some firsthand experience in that way, do you think that would have benefited his grades in the way that the movie depicts that it did?
Yes. I absolutely do. I think it's feasible. And I think that everybody learns at a different speed and has a different way that they need to learn. And some people, they read something once and they've got it. And I always imagined, although, I was bitter that he's one of those people. I've seen those people where they read it once, they've got it. And to be able to apply that knowledge, that would solidify it. As an adult learner, remember, Patch is older than a lot of those people. He has life experience. He lived in a mental institution where he self-admitted himself and realized that he couldn't get help there. So that bringing life experience and context, absolutely. That matches what an adult learner would do. And I do think that he could be at the top of his class for that.
Wow. All right.
100%. 100%.
Now, when Patch and his friends are starting their own kind of care facility out in the middle of nowhere with that cabin, Patch goes about stealing supplies from the school. Yeah. And this is kind of something that's more so just kind of put in the film and not really mentioned again. Not even at the board hearing does this come up that Patch might have been stealing from the school.
Right.
So how feasible or flimsy is it that Patch could get away with stealing supplies without being caught? And is there some kind of like inventory procedure done where they keep track of everything that they have? And would they notice that things were missing and Patch might be a prime suspect for that?
Yes, that's flimsy. Each ward or any department, like this nursing department, they have a budget for supplies and they keep track of how quickly they use them. That's flimsy. I think that what likely happened is they actually got some sort of outside funding source and they were able to buy. I wonder if that even ever happened or if that was just fun. Right. I don't know. I've never looked that up, but that would not fly here. So
do you think that had that information been presented, that would have changed the board hearing's decision at the end of the film?
Yeah, I do. I actually think that he would have been shunned. Yeah, you can't just steal. I mean, you just can't steal things. It's just not. And in the American system, at least now, every single piece of equipment that an American patient uses is scanned with a barcode. So you get a bill of every Q-tip, every gauze, every suppository is on your bill. So certainly for an American system. Now, possibly in a Canadian system, we could, because we do keep supplies for things like the third world or vets, things that are wasteful. So if we didn't show that scene and we actually had a pile of waste, like we have at Royal Inland, when we use things that haven't been touched in a dangerous way, there is a pile of things that we can use for if the vets are asking for it, or if, even a homeless person, as long as it's safe, certainly there are supplies that are available for people that got opened that couldn't be used in the hospital setting anymore. However, he's providing health care in the same context. So I think that's flimsy.
Yeah.
Yeah.
And last one we'll do is, obviously, Robin Williams is a king of improv, is a king of comedy. He knows bits. He knows what to do to make people laugh. And a big part of the film is the fact that Patch is able to go into rooms where people may be miserable, not very happy, and just get them to laugh, get them to crack up. He does so in pretty elaborate ways at times, though. Yes. And he's also been told many times by the dean to stay off of the floor. He's not allowed down there. He'll walk in there dressed as a complete angel and all these crazy things. Do you think it's feasible or flimsy that, one, he would be able to get away with getting down there in all those elaborate costumes when he's been told multiple times not to go down there? And two, do you think any of these methods could have easily backfired? And do you think that realistically it was a good idea for Patch to approach patients in that way?
I think the way he approached the children was perfect. So I actually think that's completely doable. And, all those bedpans would have been sterilized. Like, there was nothing dirty that he was really doing.
I was wondering about that.
Yeah, exactly. Everything would have gone through a process of being, decontaminated. There was nothing dirty there. I actually did watch that as infection control. Where is he getting those from? And those weren't used bedpans, so that's great. I actually thought that was perfect. Showing up dressed as an angel in today's society, are we kidding? No, there's just no way that that's going to happen. And it's not respectful. And it's not, this is the one great thing. And I won't use the W word because I think people have dumped on it. But we have an awareness that there are multiple ways that people choose to think about the afterlife. And showing up as an angel, if you haven't checked, that's a no. That's a hard pass. Okay. I think that if I had somebody that had made it into medical school and was showing up in costumes to, make people laugh as a nurse on the floor, I think I would have behaved, I hope I would have behaved like the nurses did, where they recognized what his motives were. He wasn't crazy. He wasn't going to, he had the best interest of the patient at heart. They wanted to see him succeed, I think. And did you notice how easy their life became when he started to show up?
Yeah.
It provided support. So I would like to say that as long as this person was vetted into medical school, was doing very well, and I could check their background, it was probably okay. If somebody walked in off the street, I'd be like, no problem here. Thank you so much for being so great, but we just have to hold you here for a minute and just have you talk to a few people. Yeah, sadly, you just can't trust, right? You just can't trust for sure. But I would hope that I would behave and back him up. I think that's the one thing you didn't see in the movie, is ever a confrontation between the nurses, and the hierarchy, and just have them come and say, what is he doing? How, that's what's missing in the movie, is the nurses would have been able to say, this is a great thing. And that should hold weight, but you don't see that because it's not about that, which I understand, but there's a missing piece of this film. And that is that when this is all happening, the physicians that support Patch, you hope, you see the nurses showing support directly, like providing care at the Gesundheit Institute, at the little shack. The nurses are there in their street clothes, providing care. I don't know if you noticed that, but you would hope that anybody that had supported Patch in there had spoken to the nurses and said, how are the outcomes on these patients? And maybe they did. I can't really remember, but that's the piece that's missing, is if that dean was worth his weight and was worth any sort of weight, he wouldn't have just gone on what he thought by himself. He would have gone to the floor and he would have checked results, and just to see, what did the nurses think about this, instead of just assuming. My dad used to say, if you assume, you make an ass out of you and me. And so he kind of made an ass of himself because he just assumed that this wasn't right or wasn't doing good.
And final thing we have to do here before we wrap up is we ask our guest, and I think we know where this is going to go, 2 questions. 1, do you recommend the film for someone to watch? And 2, on a scale of 1 to 10, 1 being not realistic at all, 10 being the most realistic you can get, how accurately does this film depict your field based on your experience and how you relate to it?
I think if anybody wants to see what it was like to be a nurse in the 70s, and how hierarchical, I'm not going to get that one out. It was, I would say that it's probably, I think this is an entertainment piece. So do I recommend that you see it? Yes, I recommend that you see every single film that Robin Williams has ever done. I think you should also know that Robin Williams is famous for stealing stuff from other comedians. So it's also interesting to listen to other comedians say that in his early years, he used to steal stuff. Yeah, absolutely. So that you really know who this guy is before you just start adoring him the way I do. That I highly recommend it as a Robin Williams film that you should see, one of millions. And if I'm talking about accuracy, this is a movie. This is a feel-good piece. It has a point of view. And so accuracy, sure, I would probably say it's a 6 or a 7, but that doesn't detract from the depiction of nurses or even the depiction of physicians. I think it showed the hope at that time of where physicians were going to go, and that they were going to be more personable, and that they were going to be more relatable to their patients. And we have certainly seen that happen. And this is an idea of why you would want a physician to learn in this way. And certainly as somebody that was a nursing student in the 80s, in the time of CAPS, I certainly see this as an appropriate film for the period of time that it was in that progression, from clear division between nurses and doctors to a place now that's much more collegial. Patch was very collegial. He recognized that the nurses were his allies, and also his help. How is he doing? He's doing well. So we see that now. Physicians recognize that nurses are there all the time and they're a valuable resource. So it's a movie about hope.
Nice. I did have one last quick question, because you kind of touched on it a little bit. When we were trying to figure out a movie to do for nursing, we really resisted Patch Adams because he's not a nurse.
Right.
So that was one of the big problems we had. And we watched a ton of movies that are supposed to be about nurses.
What did you watch?
We watched The English Patient, which is long.
Yes, it is.
And
Very
also not fully about a nurse.
No. No.
We watched Wit, which is more about a patient than it is a nurse.
Right.
And we watched, just going through my memory bank now.
So Proudly We Hail,
Okay.
which is just pretty outdated.
Yeah.
It's from
1942.
1942, yeah.
Yeah.
And
I think that nursing in general has been more well depicted in TV.
that's exactly
So, of
what I was
course-
going to go
Grey's
to.
Anatomy.
Yeah.
No.
Oof.
Of course not Grey's Anatomy. I can just feel the daggers coming at me. No, you need to watch ER.
Oh, ER.
So
Yeah.
ER to me is, and now The Pit is there's a reason that there's a swell. If you were around at the ER days, why Noah Wiley is so like, where did this guy come from? We know who he is. We knew him. We knew the minute they started filming The Pit, and we knew all of us were going to be lined up to watch it, even if we had to pay for Crave. But the portrayal of nursing in ER is excellent.
Nice.
The level of skill and the way that they help each other and the worries that they have and dealing and leading families. So I think it's hard to find a movie with nursing. I liked Awakenings.
Yeah.
Which is another
Another
Robin Williams film with a nurse that was, very supportive of him. I thought that was a good portrayal. Even for me, I've done this forever, I can't think of a really good movie that underscores the role of a nurse. But I also see fun ways that people are adding it. Did you notice that the newest Grinch film, Cindy Lou whose mother is a single parent, she's a nurse.
Oh.
She works
The
shift
Benedict
work.
Cumberbatch.
Yeah,
animated one.
yeah.
Yeah.
So you'll see little things get added in there, and she's sleeping on the bus, and she's having to remember all these things. And I actually think that's a great portrayal, of a nurse. She's working the night shift so she can be available to her kids during the day. And those are things that you just notice when you're a nurse. But,
Yeah.
yeah.
Well, yeah,
I think it is hard.
Yeah, I felt like there's a hole in film. It's well covered in TV, as you're
Yes.
saying, but there's a
Yes.
hole in film where nurses aren't shown as the leading character of
That's
a
right.
movie very often, and if
That's
they are, it's a little less accurate. So we did end up sticking with Patch Adams because it felt like the theory
Yes.
was in there.
Yes.
But yeah, so I just wanted to
I
hear
wasn't
if you had any
surprised.
other good picks.
I wasn't surprised you picked Patch Adams. I thought it was good, and I did think, oh my goodness, I think they're wearing caps in that movie. So I knew that it was of a particular age.
Yeah.
Remembering that films, when they get made, could have started to be made long before that, and so then those tropes and things like that can survive into the actual film, when maybe by the time it came out we weren't seeing, certainly in Canada we weren't seeing that.
Right.
I'm trying to think of anything that I would recommend film-wise. I actually really like The English Patient is very long, and I think that'd be a hard sell for a lot of people. It's not about that nurse, but also it is in a certain way. I think we're starting to see more films come out about specifically Army nurses. And of course I can't think of anything. I would have actually said The English Patient because, there's one nurse that you follow. Another one, Atonement, the movie Atonement follows a British nurse.
I haven't seen Atonement
Yeah,
yet.
but
Yeah.
that's not the story. The story
Yeah.
isn't about her being a nurse. So what I would say is that nurses are in supporting roles because that's our job. We're not
a good answer.
not the leader of the team. We're a supporting role, and that's where we should be. because we have the time to spend more time with the patient. And I don't think that a doctor is necessarily, the leader of the team, but he's certainly, or she's certainly the coordinator. So somebody has to be the coordinator, and everybody under there knows their job, and they need to help where they need to help. And so that's what nurses are great at, is you can be one-on-one with a patient, and your biggest skill is learning when you need to bring the team in. And then you're grateful that you can stay with your patient and provide that level of care to somebody who may be afraid, and that a leader is going to come in and make sure things are coordinated, because it would be inappropriate for you to leave this intimacy, this relationship that you've developed and trust you've developed with the patient, and then go to being the director. It's great that a physician comes with these emergency crews and they tend to lead, or they take their lead from the information they're being given by their teammates. So there's probably not, Nurse Jackie, fun, interesting, lovely, fun. Again, I said fun, fun because she has an addiction, which is something that nurses struggle with. So there is great TV portrayals of nurses, I think. And I do like Nurse Jackie. But, for me, go to Amazon and watch every episode of ER if you're sick, because otherwise you'll get very inactive watching 13 seasons with 28 episodes each or something like that,
Yeah.
the way they used to make TV. It was groundbreaking at the time. It was all handheld cameras, and so it was really interesting.
Nice.
But my recommendation to you, if it's a long winter day, is start ER.
Nice. Well, there you go. Perfect. Well, on that note, thank you so much. I'll give us the little outro, but thank you, Kim, for joining us. It's been
my pleasure.
It's been awesome.
Good.
So to our viewers and listeners out there, if you'd like to support the podcast, you can find us on Facebook and Instagram at Capes of Kamloops. On Instagram, there's a .pod at the end. Feel free to, shout out any thoughts you have. If you're a nurse, let us know your thoughts on Patch Adams, and we'll see you on the next episode. So with that, I'm Kyle Robertson.
I'm Zach.
Thank you very much for watching and listening.
To a special screening of Patch Adams, brought to you by the Capes of Kamloops podcast, also brought to you by StoryHive and TELUS. My name's Zach, this is my fellow co-host Kyle, and we're very excited to have you guys here tonight. This is also going to be a video podcast, so later on we're going to film an interview with a fellow nurse who works in the community, and we're going to sit down with one of the nurses and talk about the film and their relation to the film and how accurate or inaccurate it is. And that won't be coming out until next spring. It'll be available on TELUS Optic TV, the YouTube channel, Spotify. So definitely keep your eyes open for that in the near future.
And thank you for coming, everybody. Welcome. So along with tonight's screening, we have been collecting donations on behalf of the Registered Nurses Foundation of British Columbia. And this will help them to provide bursaries to nursing students in BC and in Kamloops who are seeking further education or just beginning their education journey. So for anyone who would like to donate electronically, you can find one of us after the show. Thank you.
And lastly, we'd like to thank the Kamloops Film Society for putting this event on and hosting us. And with that said, enjoy some Robin Williams' delightful comedy with Patch Adams.